Hi, everyone. I am here with Dr. Matt Wash, who is the immediate past president to the International Association for Resiliency and Trauma Counseling, one of ACA's newest divisions, who is doing some pretty incredible things. So, Matt is going to share with us his experience being president of this organization, what you should know about it as a student, and why you should consider joining it after you graduate as well. So, take it away, Matt.
Thank you, Dr. Gibson. It's great to be here, and all the students who are joining the program. Um, as Dr. Gibson says, IARTC is one of the newer division of ACA, and this is really important because when you think about trauma, traumatology, being trauma informed, it's become much more of a word that people are using. But in ACA, it took a long time to get this to be something standardized. And that's why we're so excited to actually have a division, because there are so many practitioners, people in academia and research around trauma. And so IARTC is really kind of the place to bring together all that kind of practitioner piece and the academic piece, and really to give people the kind of, information, networking, research to really do their job well. The other thing with IARTC, since we are a newer division and we're getting kind of all of our infrastructure together, we do have a journal. It's a peer-reviewed journal. So as you're entering in your grad studies and maybe PhD, look to our journal for publication as well. We are also trying to look at, what's the next step when you think of traumatology in the literature? Where does it need to go? Where are the competencies that need to happen when you think of being trauma informed? Because there's a lot of talk out there of being trauma informed that aren't really trauma informed. Just because you might know a little bit about trauma or what happens doesn't mean you're trauma informed or an organization. And so you can really kind of, part of what we do here is to create that consciousness raising. At the same time, we're in the process of creating some standards and competencies as well.
Nice. Excellent. So, in terms of the future, what are they going to be able to get out of joining? Why join when they graduate?
So here's the thing, you don't even have to wait to join, right? So you guys, you're grad students, right? You can join, and there's a student rate. And I would join now, because we have, as part of one of our committees, is a grad student committee. So you can already start networking with individuals. And if you're interested in trauma, and even if you're not interested in trauma, you're like, wow, that might be something. If you're going to be in practice, you're going to work with people who have had traumatic experiences in their life. And so you're really going to need an organization like this to come together for resources, networking purposes, how to find, peer-reviewed kind of articles and techniques and modalities for serving populations who've been traumatized. And so just join.
I love it. Yes. Thank you so much, Matt. I really appreciate your time.
Mm-hmm. Thank you for having me.